Welcome to this online class on veterinary epidemiology and public health. Today's topic, explained by Dr. Asmita Bansod from GNP Sir Classes, is environmental hygiene. First, let us explain some definitions. Ecosystem, structural and functional unit of ecology where living organisms interact with the environment. Biotope, area of uniform environmental conditions acting as a living place for a particular plant or animal species. Bioconosis, biotic community, interaction of living organisms in a habitat, biotope. Biome, it is a large, well-differentiated and climatically uniform geographical region. Many ecosystems join together to form a biome. Ecology, study of plant or animal in relation to their habit and habitat. Ecology is also known as bionomics or natural history. Ecology, study of plant or animal in relation to their habit and habitat. Ecology is also known as bionomics or natural history. Ecological climax, when plant, animal, microbes, soil and macroclimate have evolved to a stable balanced relationship, then an ecological climax has occurred. Ecological interface, it is a junction of two ecosystems. Infectious diseases can be transmitted across interface. Ecological mosaics, it is a modified patch of vegetation created by man within a biome that has reached a climax. Food web, network of interconnected food chain. While position occupied by an organism in food chain is termed as their trophic level. Ecological pyramid, graphical representation of food or energy relationship between organisms at each trophic level. Germ cloud, aggregation of large number of microbes in atmosphere. Effluent, the solid waste after secondary treatment of sewage waste. Presumptive coliform test, multiple tube method. It is a screening test for coliforms in drinking water and used for bacteriological surveillance of water samples. Emporiatrics deals with the health of travelers. Eugenics, environmental manipulation which enables genes to express themselves readily. Sullage, waste water from kitchen. Bacinosis, bagasosus, cane sugar fibers. Argyrosus, silver dust, the type of pneumoconiosis that cotton dust causes. Sterilization, the process of destroying all forms of life including spores. Disinfection, killing of infectious outside the body by direct exposure to chemicals and physical agents. Here are some water-related diseases. Water-borne diseases include cholera and typhoid. Water-washed diseases include scabies and worm infestation, and water-related vector-borne diseases include malaria and filaria. Naegleria, amoebic encephalitis, is caused by Naegleria fowleri, brain-eating amoeba, water-containing Naegleria inhaled during swimming. Recent fecal pollution of water is indicated by Streptococcus species. Remote fecal pollution of water is indicated by Clostridium species. Iron bacteria that clogs iron pipes, Gallonella species. This table shows the maximum limit in water including mercury, lead, arsenic, fluoride, and nitrates. Ultraviolet rays are harmful. Ultraviolet B rays causes mutation, snow blindness, cataract, type of skin cancer. Non-ionizing radiations like UV rays, infrared rays, microwaves, radio waves are also harmful. Let's discuss the methods of water purification. Small-scale purification can be done by boiling, storage, distillation, domestic filters, alum, bleaching powder, lime, iodine, and other methods. Large-scale filtration can also be done by storage and filtration or chemical sterilization including ozonization, chlorination, and superchlorination. One of the best method of large-scale purification is chlorination. Chlorine demand of water is measured using Horrocks apparatus. Point at which free chlorine begins to appear in water is termed as breakpoint. Retention period of chlorine is 60 minutes and excess chlorine is removed by aluminum sulfate. The size of sand in rapid sand filter is 0.7 mm. The optimum storage of river water should be 10 to 14 days in large-scale purification. Zoogalal layer. Growth of algae, diatoms, plankton and bacteria. It is known as heart of slow sand filter. Also known as Schmutzdecker, biological layer, vital layer. It is mainly composed of algae having dirty and gelatinous nature. Methods of sewage treatment. Physical method, primary treatment, filtration and sedimentation process. Screens in girt chamber, sedimentation tank and skimming tank are used. 2. Biological treatment, secondary treatment, Primary effluent is passed into aeration tanks agitated mechanically and air is pumped into it, which leads to growth of useful microbes, bacteria and fungus flocks. Then effluent is passed into settling tanks where flocks settle down and termed as activated sludge. Activated sludge is again pumped into anaerobic sludge digesters, which leads to growth of anaerobic bacteria, kills aerobic bacteria and leads to production of biogas, methane and CO2. Now water is released into lakes, river, oceans. Contact beds and trickling filters, humus tanks and activated sludge treatment are done. This table shows the headquarters of World Health Organization in different regions of the world. Let's discuss disaster management. The United Nations defines disaster as the occurrence of sudden or major misfortune which disrupts the basic fabric and normal functioning of the society or community. The Disaster Management Act, 2005 defines disaster as a catastrophe, mishap, calamity or grave occurrence in any area, arising from natural or man-made causes, or by accident or negligence which results in substantial loss of life or human suffering or damage to, and destruction of, property, or damage to, or degradation of, environment, and see of such a nature or magnitude as OTB beyond the coping capacity of the community of the affected area. There are two types of disasters, those with a slow onset, example unusually harsh winters, drought. Rapid onset disasters, example, earthquakes, tsunamis, hurricanes, floods. The table shows the water and climate disasters, geological disasters, accidents, and biological disasters. Disaster response cycle. Mitigation. The impact of disasters can be reduced before they strike, by building certain defenses and implementing appropriate policies. Mitigation can be the most cost-effective intervention of all. Measures to ensure that emergencies are prevented, or their effects made less severe. Preparedness. Arrangements to ensure that all the resources and services which may be needed to cope with the effects of a disaster can be rapidly mobilized and deployed, such as national warning systems, vaccination programs, shelters, evacuation methods, storage of food and water, identification, clinic preparedness plans. Response. Actions taken in anticipation of, during and immediately after impact to ensure that the effects are minimized and people are given immediate relief and support, such as static and mobile clinics, search and rescue operations, provision of emergency food, temporary shelters, recovery. Actions are taken to restore the pre-disaster status quo and social structure. Formation of triage. Triage, a method of identifying victims of disaster on basis life-threatening injuries and likelihood of their survival with prompt medical treatment. This table shows the biomedical waste management and handling rules of 2018. Different color codes are assigned for collection of the medical bio-wastes in different bins and they should be disposed of as per recommendations.